the health record of your patient. You only do one patient per day, except on your, so meaning on days I have evidence-based and days I have critical thinking exercises, there will be no electronic health requirement. You will not need to fill out charting. Is that made clear?
Okay.
On your CTE, critical thinking exercise day, and on your evidence-based days, those 2 days, there will be no electronic health record requirements. So you do just like you did last semester, you're gonna go in and chart. And these are the 3 areas that need to be charted on.
Cath lab, we don't.
Oh, cath lab, we don't do it either.
ER, a lot of times you can get
No,
information.
I don't know, we don't do it ED either.
We don't do
Okay,
ED, but a lot of times.
ED, cath lab, so there's 4 times you don't have to. CTE and evidence-based, you do not have to do electronic health record.
And we'll say, sometimes you'll get like the patient that we're holding or stuff, and I have had people do their charting on an ED patient because they may have been like one-on-one with that patient. They're on a vent, they're suctioning them, their total care all wrapped up in them. So.
But that will be at the discretion of the instructor. They'll tell you, since you're with this patient the whole time, why don't you go on and just chart on this? The other thing is, you only need to do it 3 times the whole semester. I need 3 electronic health record that are acceptable to the instructor for the whole semester. So that means you can be done with electronic health recording within 3 weeks, if you do it right. Okay? Everybody okay with that concept? So unfortunately, if you have ED, CTE, and evidence-based the first 3 weeks, you're going to be doing electronic health records when you get out of those opportunities. But if you have, I'm just using 3B, ICU, and CCU, the first 3 weeks of your clinical rotation, in that particular case, you will be able to chart on those 3, and as long as they were approved, which means you need to have them. We decide, I think, on Tuesdays they need to be done by Monday, and Monday they had to be done by when?
Y'all made me slack off and go Fridays, but I wanted them done by Wednesday morning because, you know, but I think we agreed on Friday.
We agreed that the best time was after Thursday because you had to be here on Thursday if you couldn't do electronic charting at home because sometimes the machine didn't work. So since everybody had lecture on Thursday, it's best just to try to get them completed by Friday. If you could get them done by Friday, then you're not going to have any problems with getting demerits for not submitting your materials in time.
And guess what? If y'all use those S-bars and take notes on those and do all that, there's your charting. It's just a matter of putting it in the system.
So 3 of those have to be completed with, and the instructor will send them back and say acceptable. So if you have them done by Friday, the instructor will have them done before the next Tuesday. So if you've already, and I keep a little record on mine, which one have met their 3, so I tell you every week, okay, you have 1 more, or you have no more. I don't want to ever see electronic health record from you again. The other thing is, when you do the health record, there'll be something that has a Braden score that needs to be done in a fall risk on every single, every patient you should be doing that on. So when you get your Braden score and you get your fall risk, there'll be a number. And you need to interpret that number. Don't just put the number down. I want you to interpret what does that number mean. Patient has no risk for fall. Patient has no risk for developing a wound. Patient is at high risk. And then give some interventions of what you do so that that patient would not progress and to have those problems. And not everybody has always done that before, but I made them do it last time because that number means nothing unless you know what the number, you need to interpret the number and then determine what to do with the number. Does that make sense? Because nursing has to follow through. We can't just come up with arbitrary information.
And that goes back to being the patient advocate again. If you've got someone on a mattress that's not appropriate for their skin condition, you know, that just costs the hospital some more money. They own that wound.
Yes, ma'am.
I was just gonna ask, are our concept maps due the same time?
I'm going to get the concept maps, but yes. Aren't they? Because I thought we had them do the same time. I prefer mine to come to me electronically too. That'd be really nice. since you have that access. And for those that are the LPNs, we'll go into more detail about the concept maps. But again, we only want 3 instructor-approved concept maps throughout the entire semester also. So again, I don't want 10, because that's how many weeks you're gonna be with patients. I want 3. And I'm the course coordinator, and I talk with my other course instructors, and they agree that 3 are adequate. That doesn't mean that in your mind you don't have to work through a concept map to be able to talk in post-conference. You still need to know, what are my priorities, what are my concepts, how do I manage this patient, what are my nursing diagnoses, but I don't have to necessarily turn something in to my instructor.